So first, I would like to ask for your permission to use this video for educational purpose and on internet.
Yes.
Thank you. Tell me about your symptoms before the surgery.
When I would be sitting especially, I noticed that I would start having really severe pain around my left side, and then it would go around to the front.
Okay.
And it almost felt like somebody was stabbing a
Stabbing you.
knife in my back, almost like it was actually bigger than like a small knife. It
Yeah,
almost
it
felt
was
like a
like-
machete being driven in there.
We call that radiculopathy, the pain that turns around, and you had a thoracic radiculopathy. How long did you have those symptoms?
For a couple of years.
So in that time, for that pain, what did you do for that pain?
I would just have, I got pain killers, and just I wouldn't be able to do a lot of stuff that I would normally do, and just wouldn't be able to sit for very long periods of time. So I missed a lot of stuff with my kids and stuff like that I wasn't able to do. Wasn't able to stand for long periods of time because it would start.
Yeah, the entire
hurting.
life changes. The whole
Yeah.
family's life changes.
Quality of life is very poor.
Yeah.
Gets to be.
We did lots of conservative therapy, and then we did a discogram, which is part of our protocol, and we found out finally what the problem was.
Yes.
And the surgery wasn't that long ago. When was the surgery?
5 weeks ago.
5 weeks ago. And we did the surgery, and I have the record of the surgery. The surgical part was actually about 40 minutes.
Yeah.
And we had a spoon of blood loss, which is nothing. We did this thoracic interbody fusion, the DTIF, direct thoracic interbody fusion, with this new technique that we have developed in the Inspired Spine. And now, I remember, you had some nausea after anesthesia, and that sort of delayed us a little, but
Yeah.
because usually people go home just one night after the surgery, but you stayed 2 nights, correct?
Yeah, just because of the anesthesia and nausea.
Yeah.
Otherwise, I probably would have went home, because otherwise it wasn't really that bad.
Yeah,
so.
and you walked, right? When did you walk?
I actually got up and turned around that afternoon, and then I was still feeling pretty sick, so they didn't do any more with me then. But later on in the evening, I got up and I walked to the bathroom, and then they got me in to sit down in the shower and stuff like that. So
How are you now?
good.
So how's the pain that was going around the chest?
I am not having that anymore.
Excellent. Now, obviously, some of the back pain with certain activities is normal, but overall, how bad is the back pain?
Actually, during the day, it's unless I overdo it. If I'm doing stuff that I really probably shouldn't be doing at this point, I start getting kind of achy, and I can tell when I probably should stop.
Yeah.
But especially the last few days this week, I've been feeling really good, and I don't start hurting really until in the evening time, just from sitting or just moving around during the day. I get achy. So.
Yeah, and you told me your life, activities, they were very limited, but you just told me that you went for a long walk yesterday. So tell me about that. How did that go?
It went really well. I asked her if she was feeling all right a couple times because I was worried about it.
How long of a walk was
We
it?
went for just about a mile.
Okay.
Walking the dog.
Okay, well, do you think you're on the way back to basic daily activities?
Oh, yeah, I think so, yeah.
Excellent. So I'm just going to swing and look at the pictures with you, okay?
Okay.
We did this surgery through a small hole through the chest, and these are the upper screws that we are looking at right now. They're in perfect position. That the spacer that goes directly in, that's why we call it direct thoracic. And then these are the second screws that as well are in perfect position. Here we are looking at the side view, and there's something I have never ever seen, that it seems that bone is actually growing in the front right here. That's fantastic. I mean, usually we say it takes 9 months, 12 months for the bone to grow, and we are 5 weeks out. Part of that is probably, even if it's growing, probably not very strong bone, but it's just the fact that it's growing, that makes me very happy. And here's the front view as well that we are looking at, that it seems that some activity is happening there already 5 weeks after the surgery. And here's the side view, and we are going to just rotate this around, and it shows us exactly how the hardware look like. These are your ribs, as you see here. This is the spacer. These are 2 screws on each side connected with a rod. So overall, how do you feel? Just 5 weeks after the surgery?
I feel really good. Like I said, this past weekend, I stopped taking all my pain medicines and muscle relaxers and everything like that.
So you're off the pain medication just within a month after the surgery. How long before the surgery were you taking pain medication?
I was probably on pain medications for probably around 2 years. Yeah,
2
a
years,
couple
wow.
years, yeah.
2 years on pain medication, we fixed the problem, and you're just 4 weeks after the surgery off the pain medication. This is a very good result, and that sort of put the burden on our side to take those kind of symptoms seriously and treat them. That is meaning that, it wasn't anything you were doing. It just, if it was, many times when things become difficult, we try just not to do the surgery. And this is a difficult surgery, old-fashioned way.
Yeah.
No.
Yes, I think if I would have had to do it the old-fashioned way, I probably would not have had it done for another couple of years until it got so bad I just couldn't take it anymore.
Yeah, I think it was getting bad enough from what I figured out. Yeah. Well, any comment, anything else, both of you would like to add? No? Thank you so much for the interview.